said it was ADHD, but it was Lyme disease. A father was concerned. A 12-year-old boy had declining focus, irritability, fatigue. The teacher suspected ADHD, but the father said he wasn't quite himself, something felt off. Now, he had other problems besides behavior. He had headaches, sleep troubles, vague joint pain, head fog, fatigue identified for inactivity, and his diet was blamed. The misdiagnosis was a concern for the father. Lyme tests were ordered. He was diagnosed with Lyme. He was started on treatment for Lyme disease. And with treatment, the focus improved, energy returned, and the mood stabilized. Now, ADHD and Lyme disease can share similar characteristics. Lyme can mimic ADHD with brain fog, poor memory, mood changes, trouble sleeping. This is because they both involved in the nervous system. Now, why it gets overlooked, behavioral labels can stop deeper investigation. So the ADHD is a diagnosis where once it's made, there often are not other questions that are asked. Lyme disease often does not present by the book. A lot of people don't have a tick, don't have a rash, they don't have a knee swelling that you can pay attention to. Also, a diagnostic delay and diagnostic bias seems to be an issue because once somebody has ADHD or behavioral issues, it's hard to bring up Lyme disease and look past a simple test. So what made the difference here is that the father trusted his instincts, that he had a willing doctor who was willing to look beyond ADHD, and with early treatment he had a good outcome. So the final takeaway is not every issue is ADHD in a child. Sometimes it's deeper, sometimes it's Lyme disease. Has your child been misdiagnosed? Was it ADHD, anxiety, or behavior, but turned out to be Lyme disease? If so, share it in the comments below. And thank you for joining me as part of this Common Sense Lyme Disease series.